Diving back into our literature review on COVID and bones, this is an autopsy study that looks at bone marrow production of cells, specifically those cells that make up our blood, in patients that died of COVID-19 infection during the first and second wave. These are 28 autopsy cases of COVID-19 patients from two different universities in Switzerland, where the first cohort of patients is between March and April of 2020, and the second is during the second wave of the COVID pandemic, with autopsies performed between October 2020 and April 2021. The median age at time of death was 78 years old, two-thirds of the patients were male, and death occurred 12 days after a COVID positive test. So it's important to note that these are just early COVID infection indicators. This is not for people that are long COVID patients, nor does this give us much information on anything that happens post-COVID because these people got COVID, got really sick, and then died. This study is also further limited to bone marrow samples taken from the iliac spine or the lumbar vertebra, where the major findings from this death due to acute infection with COVID showed that within these spinal vertebrae, COVID was not detectable in the bone marrow, meaning that COVID infection of the bone marrow is likely to be transient and that effects of these blood cell components are primarily of an indirect nature. Now, interestingly, there was no collagen fibrosis, nor was there evidence of microvascular thrombosis within the bone marrow. Now, what it did show is left-sided myelopoiesis, which indicates that there's an infection in progress, that COVID infection, and that a high number of neutrophils are being produced. And neutrophils are what help fight infection. Next, there was an increased myeloid erythroid ratio, which is an abnormally low red blood cell production. And then a high proportion of COVID-19 specimens showed erythrophagocytosis, where essentially the red blood cells are being digested or broken down. And clinically, this is correlated with lower hemoglobin levels, so it's going to be harder to transport oxygen throughout your body, while also making it harder to unload the carbon dioxide, making it harder to breathe, essentially. And there was also a strong increase in macrophages, which makes sense because they're playing that role in breaking down the blood cells.